A patient presents to my office and says, Dr. Boz, can you help me with weight loss? I've struggled for a long time and I've had some gastric surgeries in my past, so I want to know if your approach would help me. This patient had struggled. He was over 300 pounds at the time he was asking for help, and this wasn't his highest weight. He had tried every diet under the sun, and when he got frustrated, he asked the medical world for help. This led him to speak to a surgeon who said, yeah, we can help you with your weight loss problem. And they offered him something called a gastric sleeve. This process takes the human stomach and it cuts off about 70% of the stomach. They throw that part away. This leaves the patient with a pretty clear process of how the food comes into the GI lining and how it hangs out in the area of the stomach. But the amount of food that he can tolerate now is much less. And in fact, the patient did lose weight. He was able to continue his life, really didn't have any struggles with recovery. But over time, he stretched that stomach right back out and didn't have the long-term weight loss he was hoping for. He then returned to the surgeon and said, is there anything else you can help me with? And this time he said yes to a much more serious surgery. This surgery is called a Roux and Y, or French for a puzzled mess inside your system. And even though the system starts out looking like this, the surgeon takes the very top of that stomach and he cuts it off from the rest of the flow of food. So as you swallow food, if there was nothing else done, it wouldn't go anywhere in your system. The surgeon doesn't end there, though. He finds a distal part of the intestines, that section about a foot after it leaves the stomach, and he relocates it to the top section that he walled off. So now the volume of food that the patient can eat is extremely small. And when you look at the process of where the food begins, how it comes into the system, and then takes a hard right turn down through this intestinal process. And although it dramatically decreases the amount of food that he'll eat before he feels full, it also changes how he will absorb food. The first problem that I help patients with after a gastric bypass is making sure that they remember that the B vitamins are all absorbed in this stomach part of the intestinal flow. The B vitamins have lots of little nuances about proteins that need to escort them to different areas of the body before they can be absorbed. And so to have a B1 deficiency or a B12 deficiency is very common after this surgery. And it's because the food never touches the area of the stomach that was responsible for those B vitamins. The second part of the limitations that this patient needs to be aware of if we want to help him lose weight and get to his optimal health is that this section of the GI tract is a critical part for absorbing several micronutrients. Those include iron, it includes copper, it includes zinc, and it includes magnesium. There's other micronutrients, but the most important ones of these are the iron, copper, and zinc. And I frequently find that because the foods that have those micronutrients in them no longer flow past the cells that are responsible for absorbing them, that within a couple of years of this gastric bypass, they may have lost some weight, but these nutrients are routinely suboptimal within their systems. The next couple of things we need to consider with a patient who's had a gastric bypass is we must consider this little organ right here. It's the gallbladder. And even if you don't have a gallbladder, this little hose here is the section that's draining all of the bile that comes from the liver, and it is supposed to emulsify and put the bile into the food where it emulsifies the fats, making them more absorbable in our systems. But as with this patient, those fats no longer travel in this section. So they do not have the area that would naturally stimulate the production of bile in their systems. And frequently you'll find that people who eat a lot of fat after a gastric bypass, they say, yeah, doc, I am losing weight because I seem to poop it all out. I don't have the absorption of those high calories. And although that sounds like a good idea, there are some critical fats within the system that your body must have. They are the vitamins of vitamin D, vitamin E, vitamin A, and vitamin K. These are all fat soluble and they require an emulsification of bile to be able to absorb them. So this patient must consider that. Not only do these fat absorbed or fat soluble vitamins have a section of the gut where they're absorbed, once they are inside a person who has struggled with obesity, they are under the dictatorship of insulin. Insulin instructs energy to be stored. And by the nature of being obese, insulin is high in these folks who are going for gastric bypass surgery. So they often enter the surgical scene with low volumes of vitamin D. And where are those vitamins at? They're stuck inside their fat cells. They're not circulating and being used within their systems. So it's yet another setback that these patients have to consider. The final thing that I like to point out for a patient with gastric bypass is that this organ right here is called the pancreas. And again, the pancreas is going to be waiting for the foods to trickle past the area of the gut that directly signal the pancreas to release those pancreatic enzymes. Without that present anymore, these patients, again, have a difficult time connecting the food that they're eating to the secretion of those pancreatic enzymes that are required to absorb those fat-filled molecules. So in a patient who is coming to me saying, Doc, I've had these gastric surgeries, can I keto? The number one answer is, I believe the only option for losing weight long-term is to use a ketogenic diet. That it is the chemistry processes that are broken within this 300-pound patient. And despite the well-intended efforts of two very skilled surgeons, the surgical rerouting and the surgical removal of his stomach did not result in long-term weight loss. Now we have quite a puzzle. His gut is not very efficient at absorbing these micronutrients. And when they are looking at the health long term without the copper and iron and vitamin D and magnesium and B vitamins that use that section of the gut to take the nutrients from the food to our bodies, these patients no longer have that. So when this patient asked me, can I keto without my proper anatomy of the gut? I told him, absolutely. But the most important reason that you need to keto isn't just because it's an amazing chemistry shift of how to actually lose this weight forever. Your gut lining is destroyed. Your gut lining has not been normal since you've been overweight. You can call it a leaky gut, you can call it malabsorption, but the processes for reversing that inflammatory setting of his gut are best reversed by a diet that is an anti-inflammatory type diet, which is what the ketogenic diet really is in its chemical nature. If you want to know more about your gut and why it might be leaking, check out this video. I'll teach you more there.